Than 18 million Americans live in low-income communities that don't have easy access to grocery stores. That includes right here in central North Carolina. WRAL investigative data journalist Ali Ingersoll is looking at how Duke is working to fix this.
About 1 out of every 10 people living in both Wake and Durham counties are food insecure, data shows. Now, Duke Health, along with a number of community organizations, are partnering together to address those concerns as they're looking at food as medicine.
Food is universal, what everyone needs. There is the immediacy of now when one is hungry.
Peter Scalern, the CEO of Reinvestment Partners, shows us around Farmer Food Share, one of the organizations working to address food insecurity across the state by providing fresh produce grown in North Carolina to those who lack access to it. 1 out of every 5 people in this area live below the federal poverty level, data shows. And the closest major supermarket is over half a mile away.
Being food insecure also is often related to being housing insecure, which is really related to being economically insecure.
Many of our outcomes come down to where we live. More than 150,000 people in Wake and Durham counties live in areas that are low income with low access to supermarkets, USDA data shows. And that lack of access to nutritious foods has impacts on health outcomes, according to research. That's why Duke Health is getting involved. In 2019, they began screening patients for unmet health-related social needs. Food insecurity sits at the top of the list, according to Deborah Clark-Jones.
We can't separate these unmet social needs from healthy living and academic performance, employment performance. It's all interrelated.
The organizers say that there really is an urgency of getting this done right now because the food that we're currently feeding our residents affects the futures of our cities. In Durham, Ali Ingersoll, WRAL News.